Dr. Mobley here. In preparation for your surgery, we're going to prescribe you several medications, and the purpose of this video is to explain them to you so you know which medication is for which purpose. And to use a little bit of casual language, let's pretend that the medications are in two different buckets. So let's say the blue bucket is the main bucket of medications that you're for sure going to need for your surgery. For most patients, that's going to mean a pain pill, typically oxycodone, a non-narcotic pain pill, typically Celebrex, an antibiotic, most commonly cefadroxil, and an anti-nausea tablet called Zofran. So those are sort of all of the standard medications in your blue bucket that you're definitely going to need to get through your surgery. Special use medications. They're special use, but they would still be in your blue bucket because they are important and they're definitely part of your surgical experience. One common medication is Mupirocin ointment. We use this in mainly two different categories. If you're having elective face lifting type of surgery, we want you to start Mupirocin a couple weeks before the surgery, placing it in your nostrils. Why do we do that? A certain percentage of people in society actually have Staphylococcus bacteria in their nose, and the Mupirocin will get that out of your system before your surgery and prevent a serious postoperative infection. So it's really important. The other group of patients are patients undergoing cosmetic nose job surgery, rhinoplasty. We put those patients also on Mupirocin for a very similar reason. Now let's switch to lower eyelid surgery. If you're having lower eyelid surgery, you might be given a prescription medication called Tobradex. Tobradex is a drop that has a little bit of antibiotic in it and a little bit of steroid. We'll explain to you more how to use this in the days after your surgery, but bring it with you and we'll actually start it on you in recovery room. It will take inflammation out of your lower eyelids and help you heal more quickly and effectively. And then finally, if you're having upper eyelid surgery or certain types of lower eyelid surgery, you will get a smaller medication tube, most often erythromycin. I call it the Tootsie Roll size tube. It's a small amount of antibiotic ointment, so you can kind of remember that the small tube is for the small incisions. This is most commonly used for your upper eyelid incisions and in some special cases in the lower eyelid. This only goes on the stitches and never goes in your eye. Now in the green bucket is your backup medications. I've been doing this for over 20 years, and what we've learned as a practice is that we could never predict which patient might need which backup medication. But the reality is you often need them at 9 o'clock at night, the local pharmacies close, so we give you a few tablets just to sort of protect you in case you need them. In your backup bucket, in your green bucket, are going to be different medications. For example, clonidine. That can control high blood pressure. This is particularly important after face and eyelid surgery. Another medication is Phenergan. Now, Phenergan is a suppository for more extreme nausea or vomiting after surgery. I sort of joke as a doctor that no one wants to take a suppository, but if you're really nauseous and you're throwing up, it's the best thing because you can't throw it up and it's a very effective anti-nausea medication. There's another medication called TXA. TXA is a special medication that can help with postoperative bleeding and oozing. Again, if you need to take it, we'll let you know. These are all in your secondary bucket, your backup bucket of medications. The final medication that we don't prescribe to everyone, but we do prescribe to a lot of people, is clonazepam. Clonazepam is a very mild sedative. Think of it, maybe people might know the medication Valium. It's kind of like a smaller serving of Valium. So for people that are particularly known to be anxious about their surgery, maybe you're worried about getting a good night of sleep the night before your surgery, maybe after surgery you're just not comfortable, you're not in pain, but you just need a little something to help you sleep, that's where the clonazepam comes in. So again, two buckets of medications, some that you're for sure going to need, that's kind of the blue bucket, some that you might need, the green bucket. Very, very important. On the day of your surgery, bring all of these medications with you because we'll know for sure which ones to give you at which time. So please bring them all with you, and that makes sure that on your day of surgery, things go as smoothly as possible. I hope by explaining these medications, we give you a smooth, easy recovery. We look forward to seeing you in the practice. Have a good day.